Well, I'm very happy to take on the next stage of the presentation today and really talk a little bit more about the actual virtual interviewing process. I think my sharing isn't going quite right, so let me do it differently. Sorry. There we go. Okay, so I'm going to talk a little bit more about virtual interviewing and how we can really think about best practices for that process. I do not have any disclosures to share or conflicts of interest. My objectives are really to think about what is known about the implementation of virtual interviewing in GME that we have all experienced over the last 4 years, and think about some of our best practices for virtual interviewing. So background, pre-COVID, virtual interviewing was done occasionally, but it was actually quite rare. There were a few studies that were done in smaller residency and fellowship programs where residents were given either an option for virtual interviewing versus an in-person appointment, or sometimes given an option for a virtual interview as a screening tool done before in-person interviewing. And when the applicants and programs were surveyed, they showed, not surprisingly, a cost benefit and time saved that they thought was great. But both applicants and programs were concerned about whether they were able to identify the nebulous fit or really understand the culture of the residency program or fellowship program. So a little bit of data, but not a lot. And then, in 2020, we all know what happened. This lovely bug became an issue for us to experience. And we all kind of built the plane while we were flying it. We sort of had no choice but to go to virtual interviewing and figure out what to do over the course of a few short months and really prepare for it. But it's been 4 years and we've been doing this for a little while. And I wanted to go through a little bit of kind of what we've learned over this time frame. When we talk about some of the pluses, so always looking at the silver lining of advantages, travel costs have really come down. So the average training program spends somewhere around $12,000 to $15,000 per spot filled. So, $150,000 to $200,000 to $300,000 in recruitment processes. And applicants spend a lot of money as well. So depending on what type of field they're going into and how many interviews they might have to do, somewhere between $2,000 or $3,000 to up to greater than $10,000 is spent on travel. Efficiency, there's both good and bad to this. The applicants can meet with many more programs. They're not spending a day of travel to get to a program and then a day of interviewing. They really can interview for 5 programs over the course of 5 days, and sometimes even more than a program a day over that time. In theory, this means that applicants are spending less time away from learning in their 4th year. I'm sure many of you have seen all of the different memes about how much time and effort you're spending in your first 2-3 years of medical school. And then in 4th year of medical school, there's very little actual education happening. Most of the time is spent on virtual classes and interviewing. It's not totally clear that by doing interviewing virtually, students are spending some more time getting some dedicated teaching before they get on into residency, but it's a theory. It's been some great studies that have shown what the carbon footprint of everybody traveling around for interviews is. And one of the estimates is that we've saved 52 metric tons of carbon per season by not doing medical school to residency interviewing. There's also some really interesting advantages from a diversity, equity, and inclusion. I've had many new parents interviewing with us who delivered, a week or 2 before the interview that they had, and it certainly made it much easier for them to travel. For international medical grads, not having to travel from overseas can make a significant difference beyond even just the cost advantages. So really some pluses that come from virtual interviewing. Got to talk about the other side of things, though. From a challenge standpoint, when we talk to learners and interview and survey them, they feel that there are limited opportunities for some of those more informal interactions, that sometimes maybe they believe a little bit more than the more curated experiences that we provide them. So opportunities to walk through the hospital and sort of witness how people are interacting, go to a conference, see what that looks like, see how a resident interacts with a nurse when they're walking around in the hospital. So less opportunity for that. Obviously, less opportunity to see what's going on outside of the hospital. So what is the town like? What is the community like? Where might I live? Where would my children go to school? That sort of thing. Also, as you can imagine, if you're just on Zoom and you're sitting in the same chair every time you interview at a different program, they all kind of blend together after a while. You're like, that person that I met on screen that day, what about that person that I met on screen? Where were they even at? So some difficulty with sort of really those distinguishing metrics. From a program standpoint, when we look at surveys of program directors, they find it a little bit more difficult to gauge actual interest. This idea of application inflation, they're interviewing many more places. Do they really want to come to my program? And so what does that look like? Also a little bit more difficult to gauge those interpersonal relationships. I always joke as a pediatrician, we used to really like it when the resident who hosted the pre-interview sort of get together the night before had a child, and we got to see how does that applicant actually interact with the child? Are they excited about that, or are they like ignoring the kid because they want to talk to somebody else? And there was some intangible that we got from that aspect of things that we thought was kind of nice to know about from a pediatric standpoint. And then this nebulous fit that keeps coming up. What does that actually mean? And is it really just another word for bias? It's a good question. We know that virtual interviewing, people feel like it's pretty good for communication skills and competence. Some program directors felt that it did indicate, give you a good sense of sort of interpersonal skills, at least between you, the interviewer, and the interviewee. Didn't seem like it was a very good way of assessing an applicant's clinical skills, their ability to function as a resident, their commitment to the specialty in the program, and professionalism. You don't know whether they were nice to the administrative staff or they showed up, and those kinds of things that sometimes you can get a sense of in those impersonal visits. And so again, that fit, does that mean they look like us, act like us, talk like us? Which isn't really the thing that we should be looking for when we're looking at applicants into residency. What do applicants want from interviewing process, whether really mostly for virtual interviewing, but probably also things to think about in the face-to-face interviewing. One of the things that really is important is having an up-to-date website with profiles of the people that they're going to be meeting with, probably profiles of the other residents, so they can get a sense of, if I were there, who would I be meeting with? When you're setting up the interviews, really having very clear instructions as well as a contingency plan. So what do they do if they lose internet connection? Who do they call? Do you have someone who's really there sort of shepherding them through that process? Some applicants have expressed a desire to have a live virtual info session by the program director with questions. This one always strikes a little fear in my heart, because actually one of the wonderful things about virtual interviewing was that I could record the presentation that I gave 40 times a year previously, and only have to do it that one time instead of trying to seem excited and interested in that verbal presentation at the end of the interview season. I have put on earphones to this recommendation, and I've ignored it, but it is one thing that sometimes applicants will say. I find they say it earlier in the interview season, and by the end of the interview season, they realize that spending even more time on Zoom is not actually their preference. Most applicants will say they want somewhere between 3 to 5 one-to-one interviews of around 15 to 20 minutes. Although some programs have implemented some panel interviews, those don't seem to be as well received by the applicants. They want to have an opportunity to have some sort of informal interaction with trainees, either during the day or in evening sessions. And they want a dynamic model. So not you have one Zoom that you meet with one interviewer, and then there's another Zoom that you meet to another interviewer. They want something where you come into a large group, and then usually a host, an administrative staff member, is assigning you to breakout rooms and sort of moving you around in that way. They want to have some downtime, so time to take care of personal needs, time to take a little bit of a break, turn their camera off, take a deep breath, those kinds of things. They want to know what the place they're going to looks like. So some sort of tour, whether that's a video tour or a really good curated list of photographs of both the hospital and somewhere outside of the hospital. They also want a relatively short day. So nobody likes to sit on Zoom for 8 hours. They don't want to sit on Zoom for 8 hours. So somewhere in that, 4 to 6 hours is probably the maximum amount of time that you want to spend sitting with them on Zoom and really getting them talking to people at your program. So those are sort of structural things. I want to talk a little bit about communication and how we can optimize communication to both develop that interpersonal relationship with the applicants and get them to have a better sense of what this is, this place that they're interviewing at and what that looks like. We looked at a couple of models that are really from the human resource management literature to really think about what those theories around communication might be. One theory is the media richness theory. This is the idea that richer modes of communication that have many more threads that come into them, they carry more cues, and that allows for a more immediate feedback, and communication is more effective. So this is face-to-face. You're right with somebody, you're seeing all of their interpersonal or nonverbal cues, you're able to communicate and do this on a just-in-time moment. We all know that email is not the greatest way to communicate all those things. And so email is obviously on the far end of that, and not a way that we interview, but putting up web-based interviews and phone interviews, you have fewer of those opportunities to provide that really rich level of communication. The other theory is media naturalness theory. So similar to that media richness, this idea that the more natural it feels, the more close to being one-on-one with someone, the better it's going to feel for the applicant and for the interviewer. I think this is something that we've all gotten better with, and there's some sense that familiarity with this mode is making a difference. So when I think back to those first Zoom meetings in 2020, it felt really weird. I think we hadn't really figured out how to use some of the chat and other verbal cues within the signaling process, but now it's feeling a little bit better. And probably we all feel that way with patient interactions as well as with interviews on Zoom. But keeping that in mind, that you really want to have it feel as close to as if you're in a room with somebody as you possibly can. And then this idea, again, around communication, the signaling theory, this is the idea that if you don't provide information, we will fill it in. So I don't know if anybody has seen any of the interesting studies from, again, back in 2020 when people were wearing masks and the sort of image that people would make of what someone's face looked like behind the mask, and then they would take the mask off and they're like, wow, you don't look at all like I thought you would. This is that idea that we fill in those blank spaces whenever we can. And so you want to provide as much information as you can. You don't want to be incomplete or ambiguous, because you'd like that they would fill it in with positive, great things, but maybe they'll fill it in with maybe less desirable things. So really thinking about the communication that you're providing to your applicants is going to be really important. So best practices for communication, kind of taking these theories into mind, you want to optimize synchronization. So you want to have the best interface that you possibly can. Increase visualization of facial expressions. So having good lighting, having the computer and your camera set up so that it looks like you're looking people in the eye and really having that in-person type of experience. Using your body language effectively. You don't want to use your hands too much, but you also don't want to be sitting directly with no kind of with a blank expression. Some interesting data that probably using rolling chairs is less optimal. So trying to have a nice steady chair as possible. Really watching for the verbal cues from your applicant. So in an in-person interview, someone might lean forward like they want to ask a question, and you would listen, you would see that cue and you would address them. And, oh, is there something that I can tell you about what I just said? Watching for that is a little bit trickier in a virtual setting. And so they may feel like they have to interrupt you. So even heading that off at the beginning and sort of having a plan of how they're going to stop in the middle and ask questions might be useful. Minimizing signal distortion, so having good reception and those kinds of things are also really important. I think we've all gotten a little bit better with those kinds of things. So really thinking about what do we do next? We've moved into this era of virtual interviewing. Now, are we backing back from that? Where do things stand? I think each type of, each residency program, each institution has some slightly different policies around this. Each residency field has different policies around this. There's some pros and cons to this concept of a hybrid option where you do virtual interviewing and then maybe you lock in your rank list and then applicants can come for an in-person interview. know that I feel this strongly as someone who's from Michigan, that February, after we've done all of our virtual interviewing, February is maybe not when Michigan shows itself off the very best for applicants. And we can have some, snowstorms and ice storms that aren't typical for the rest of the year, but I don't want my applicants to judge me based on the weather that they happen to experience during that day they came to visit. I'd much rather they came in October, November, December when we're doing those virtual interviewing. So some weather issues that can relate to that. Also, from an equity issue, we talked about the cost benefit of going to virtual interviewing. If you have to spend all of the time and money that it does take from like faculty stepping away from clinical responsibilities to do virtual interviewing, and then turn right around and do a whole round of in-person interviewing, you've kind of actually defeated any benefit that you might have gotten from those virtual interviewing. It also, again, from a diversity, equity, inclusion standpoint, all of those things that made it a little bit easier for some applicants to come for interviews virtually, now, if they're going to have an experience, they have to come in person. So really thinking about what is that going to look like and how are you going to manifest that is useful. We heard a little bit about some benefits of having residents involved in social media presence. You don't want the gray-haired people doing this. You want the other people doing the social media. Really thinking about that, especially during interview season, but also throughout the year. This is a nice opportunity to think about who are those faculty and other staff who might be mentors or coaches for your applicants, way to highlight fun things that your residents do in the community, ways that they get involved in education and learning within the hospital. So really thinking about what are those pieces of your program you want to highlight and how are you going to do that over the course of that social media season. Signaling is not something I'm going to get into a long discussion about, but different programs, different fields are really experimenting with this, really as a way to help with that application inflation and trying to think about how can we really identify folks who are interested in our programs. What does that look like? How do we not disadvantage smaller programs who maybe don't get signaling in the same way, but really we can find the best matches for all of our programs, because I think there's a great program out there and a great applicant out there for all of us. It's also a really nice opportunity when we're talking about this uncomfortable sense of fit being maybe biased, is to think about what are your best practices for interviewing. Is this an opportunity to really think about how do you ask questions that get at, is this person going to be someone who's going to thrive and excel in your program? Is this the best place for them from an educational standpoint? Maybe thinking about doing some standardized questions, using behaviorally based questions, really having a standardized process so that you're really thinking about the interview process as a really robust and valid piece of information that you can use in both the recruitment and selection process for your applicants. I've got a couple references here that'll be in the slides, and then I'm looking forward to answering questions later on. But I will stop sharing my slides now.